Excited to roll, Doc. Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic is more on Tylenol. Is taking Tylenol, acetaminophen, during pregnancy considered to be safe?
It depends on who you ask. Presently, the ACOG, the American College of OB-GYN, and the Canadian Society, that is the SOGC, indicate that acetaminophen or Tylenol is not only safe, but it's valuable for use in pregnancy.
Okay, it's crazy to think about that, Doc, because of what we've been hearing on the news, right, about it?
There's a lot of opinions about it, and certainly I think the FDA is more accurate, and that is, be careful. That's what they're saying.
Exactly. What is the official view of the American Academy of Pediatrics?
The AAP has responded also to President Trump's statement linking Tylenol to autism by asserting that there is no causal link between autism and Tylenol use, and they call that the president's claims misleading and dangerous.
Interesting. But a lot of things that are good for our health, they don't think is good for our health, according to different medical boards.
You have to take into consideration where these people are coming from. I'm sure my feeling is these people are quite left-wing, and if Trump said black was black, they'd say it was white. So they have to be they have to be the opposite of Trump.
Got it. Is Tylenol a good pain reliever?
No, it isn't. There are certainly a lot of people who think that Tylenol is a good pain reliever. As a matter of fact, every time you turn around in a hospital or a nursing home, you've got a nurse or a caregiver giving somebody Tylenol. But it actually helps the nurses more than it does the patient.
I see. That's another thing I would have had no idea about, Doc, is that it's like really unbelievable in so many aspects. All right, next question we have. Is Tylenol a good fever reducer?
Actually, it's quite good, and so is, of course, aspirin, and so is Motrin and all the other NSAIDs like naproxen and anaprox. But yes, Tylenol is a good fever reducer.
If you have a fever, should you try to reduce it?
Well, I think that a fever is your body's protection. It's your body's normal response to being attacked by a virus or a bacterium. And some people think that it is a popular belief that the fever is the problem. And the fever isn't the problem unless it gets to be very high, like 103 or 104 degrees. And if you're up there, say 105 or 6 degrees for very long, you start really interfering with your body's normal function, like cells start breaking down.
When should I worry about a fever?
I think, again, if you have a fever that's 104 or over, that's probably the time when you want to start taking Tylenol to reduce the fever. But of course, your body, again, the fever is your body's protection. And if you have a fever that's really over 101 or 2, you probably need to be asking why, and you probably need to be getting into your doctor for an appointment. Unfortunately, a lot of times if you'll go to the ER or a walk-in clinic, they'll just give you Tylenol and tell you to go home.
What is the cause of death in heat stroke?
It has to do with multiple organ shutdown, like a heart, brain, liver, kidneys. The fever causes cellular disruption and enzymes leaking all over. So it's pretty much all over your body.
So basically, when should I worry about having a fever? Why should I? Yeah.
Yeah. First place, it's a sign that your body is being attacked. So something is going on. You should probably try to figure out what it is. A lot of very serious illnesses start with a fever of 101. That's probably a time you want to get to somebody who has some ability to diagnose why you're having the fever.
All right. The best place to go is ruraldocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right. That was the Rural Doc Allen podcast, guys.